Hi, I'm Michelle, the roaming dental hygienist, and welcome to my storefront, specifically the video that teaches you how to brush your teeth. And yes, I do mean how you brush your teeth. One thing that I have found in the 23 years I've been doing this is that most people were taught how to brush their teeth at a very young age. They were left to do that brushing with some check-ins from their parents, making sure everything is clean and actually happening, And then we kind of kept with that brushing technique until we're in our 30s, 40s, 50s, 60s, etc. And along that journey, we have had braces. We have had what we call mixed dentition, meaning some baby teeth and some adult teeth. We've had teeth extracted. We've had crowns and bridges and maybe even dental implants. We've had crowded lower anteriors. We start gagging more. There's a lot of reasons that we should adapt our toothbrushing technique, but we kind of don't, because it is a fine motor skill that we learned very young. So when I talk about toothbrushing techniques, that is not going to be something easy to change. And I want you to give yourself some grace on this, because what you'll find is that you kind of migrate back to those old habits, those old brushing techniques, until it becomes a plasticity change in your brain to give you that new fine motor skill when you go on autopilot. And we all do that when we brush. So I just want to throw that out there. Show yourself some grace when you're trying to change this toothbrushing technique. I'm going to start with the manual toothbrushes. I told you all that I like the tapered bristled brush. Tapered bristled brush. These little kind of feathery leg-like guys here, because those are great for gum health. So these are going to get down into the space between your tooth and the bone and the gum. It is also going to get around the curvy parts of the tooth, and it's going to help us get in any of those crowded areas that we all struggle with. I am only recommending extra soft and soft, and I get a lot of debate on that, but for extra soft and soft bristled brushes, imagine cleaning anything. Like if I tried to clean the shower here with a scrubby brush, like a hard, dense, medium to hard bristled scrubby brush, that's fine because it's a flat surface. But if I get any kind of curves, anything kind of overlapping, like your natural teeth, those harder, stiffer bristles are not going to clean it. They're just not, y'all. You need the flexibility of a bristle or of a softer bristled brush to get into the mini curves of our teeth and into our gums just slightly. That's important. So that's why I like extra soft, and that's why I like the tapered bristle brushes here. So I'm going to show you just quickly. We're going to do, let's choose the TePe Supreme brush. I like it because it has that nice grip to it. This is only going to come in soft. The Nimbus will come in an extra soft if that's what you need. But what we're aiming for is aiming towards the gum line. You see this here? Aiming towards the gum line. If we're up at the top, we're going to be like this. And you want to just overlap slightly. I like a back and forth and a little curve, a little circle here. And the things that you have to remember, let me switch out my dirty model brush for a regular brush, is overlapping just slightly. That's all it is, okay? Now, here are the places people miss often. Every time I am seeing patients, I use a disclosing solution. It shows me where the bacteria is in their mouth. Here are the places that they miss. The back here. It's because you have this cheek muscle sitting right there. We often hit that cheek muscle and we miss that area. The lower anteriors, you know, these are the front teeth where you get a lot of calculus or tartar. And then right here by the tongue on each side. They also miss whatever corner of their dominant side. So if I'm a right-handed person, I would miss the corner here. And that's because we're really good going this way, but we're not really great going this way. So we're really good at going across the body, and then we make the flip. And unless you know how to turn and move your wrist and elbow shoulder situation here, you're gonna probably miss this side, or your brain will go on autopilot and you'll be great at just kind of sticking over here. This is just where you stay, not over here. So we're gonna change that. So I want you to stick around for these adjustments to your brushing technique. Here is your manual toothbrush and really electric toothbrush adjustment number 1. Whatever your dominant side is. I'm a righty, so I'm gonna start on the right. You're gonna do this way, and then make sure when you go back this way, you come back. So this is what happens. That's not what we're doing anymore. You can adjust your head even. You can go this side and adjust your head. But what I like to do is always keep my wrist, arm, everything kind of in my like nose area, right in the middle. And I adjust my head. Now, if you have any neck issues, that's obviously going to be a little bit more of a problem. But you can see how when I'm brushing, I adjust my head. I have better, I guess, dexterity instead of I kind of come over across or get my shoulder back. I mean, you could do that, but I like to move my head like this. Your second trick to adjust your toothbrushing technique, because you're probably getting this wrong, is reaching those back teeth. Everybody goes, ah, and you reach the back to reach the back in that muscle right there. That's your masseter muscle. It clenches down and it kind of lays densely on top of your back teeth. So we're gonna close our mouth and potentially slide your bottom jaw right or left to give yourself more room, like this. You can see how much more room I have. And some people have molars that just sit so far back there, they're practically in your ear holes. And that shifting of your jaw back and forth is going to be a game changer. That's a huge trick. You'll notice instead of being parallel, I actually come out here just a little bit to get the back side, this like little corner spot right here. So in order to reach that, instead of going straight there, I'm gonna come out this way and get the corner, the back side of that. And that looks like this. Notice how I'm holding it nice and light. No, none of this. None of that. The third place people often miss, and the trick you're gonna use and change up your habits, is getting these bottom front teeth where we get a lot of calculus there. Now, if you are an over-calculus builder, I don't care how well you do, you have very little biofilm when you go to the dental office, and you still have calculus or tartar, I would check your tongue posture. There's a video on that. But when your tongue sits low, my clinical experience is that people will always have a lot of calculus. When the tongue goes up, the salivary glands here allow that fluid, your saliva with all of the, calcifying properties, your calcium and phosphate in your saliva that will harden that bacteria, kind of gets it out from the floor of the mouth and lets it flow. That's just my clinical experience. Now, my trick for brushing these bottom front teeth is to not actually try to We're not trying to do that. We're actually going to go straight up and down. So And I'm going so that I can touch the gum line right here. And we're just doing these vertical strokes, really focusing on one tooth at a time. Sometimes I'll do a little circle. And I personally have a retainer on the bottom of my front teeth, and so I will wedge these bristles underneath that retainer to prevent any calculus. Just like that. So the next trick and change you're going to make to your brushing habits is brushing the tongue side here. This is an area that, we were taught to brush the tops of the teeth. Brushing the tops of the teeth, and then it's easier to brush things that you can see. And so the tongue side is not an easy place. And quite honestly, the tongue's in the way. The tongue's in the way, and if you're gagging, it's annoying and blah. And some people's tongues are just too large for their faces because they didn't have tongue posture that allowed their face to grow when they were kids. So now they got like a small little jaw and these tongues that just feel too big for their mouth. And this is gonna make that a little tricky, but I'll show you some workarounds. So when we are brushing the inside, what happens is that you just naturally stay here. So you're staying like right here at the top, and you need to go on the inside, y'all. You see how I'm doing that same 45-degree angle that I'm using on the outside, on the inside there. And so what I am doing is really kind of working my way like that, like that. Now, if your tongue is in your way, and it often is, especially in the morning time, I will just use this top portion of the bristles, like just this little bit, and I'll come this way. And that does require a back and forth with the shoulder, wrist, elbow situation here. And all I'm trying to do there is not stuff this giant toothbrush where my tongue is already upset and is causing me to gag. This is going to help prevent that for the most part. If you feel like you're a big gagger though, wait later in the day. It tends to help with that. So that's the trick to get by your tongue. That is one place that most people miss. It's where we see a lot of gingivitis, a lot of periodontal disease. And so let's start getting down there by that tongue area.